practice of charging an insured double and triple. This is criminal. I don't know how else to put it. Why would anybody assume that somebody who can't afford health insurance should be charged double or triple for the same service? Well, we got a special deal with the pharmaceuticals and with the health insurance companies, so that's our deal with them. That's our little side secret over here, but we're going to really stick it to you guys. So that means that 50% of the bankruptcies in the United States, 50% are due to medical bills. People thrown out of their homes, can't pay any other bill. They got the creditors on their back until they pay. Why have an open-ended checkbook and say, here's what it's going to cost, and then have everything set up so you don't even know what it's going to be, and then have, if you don't have insurance, charge so much. Last two items, emergency room and refill on prescription. These are really important issues. Emergency rooms are having a heyday. You come in, you can sit for 2 or 3 hours, and you walk out with a $2,000 to $3,000 bill for very little service. You'll sit there, you'll occupy a chair, you may be in that room for 5 minutes, but whatever it was, they said, well, we had this, 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 and this, and this, and they send it off to the insurance company as if it's legitimate. I'm saying you need to triage people. First come in, find out what your problem is. Take care of it, move on to somebody who's really sick or injured, and take care of them as an emergency. And the final item here is to say refills. If I'm in my car, I'm generally not going to drive without a spare tire. I probably put an extra battery or two around so in case I have a thunderstorm and the lights go out, I've got a flashlight. Why can't we have refills for prescriptions? Why do we have to wait and beg for a doctor to open his office and say, may I please have a refill on what you've already prescribed? Now these are some common sense things. We could talk about any one of these for quite a while. But that isn't what we're here about tonight. We're just here to start the dialogue and get it going. And I'm going to turn this portion of the presentation to my colleague, Ron, for the rest of the story. Thank you.
Okay. Well, I'm just going to kind of continue. Did all of you get this? It's in the back, and maybe you'll have to pass it out if you didn't get a copy of it, of the how to lower healthcare costs through non-drug alternatives. And I'm just going to jump right in here and point out that healthcare is not healthcare. It's a sickness care system that we're in. And it's a reactive system instead of a proactive system. And the other big distinction is that it's a system that treats symptoms and does not look for underlying cause. And so, as a result, you're not really, to use Walt's term, dealing with the biology of the patient. You're dealing with the social symptoms, the fears, the concerns, and many people believe that if their symptoms are better, they are better. And I use the example of coming into the gas station with your oil light on and the mechanic saying, yeah, I can help you on that. Here's a piece of black tape. Just cover up the oil light. You'll feel better. Call me when the engine quits. And really what is needed in the area of health is a lot of education and a lot of commitment and a lot of time where people cultivate healthy behaviors, healthy attitudes, healthy diet. But our system is not geared to that. Our system is geared to just the 5-minute visit or less with the doctor and quickly putting on a diagnosis, and by the way, here's your prescription for that particular problem. Now the reason I'm here, I'm a family physician because I grew up working in my dad's gas station. I use a lot of car analogies. But my dad got to know his customers and he took care of their cars. He diagnosed their true problems. He didn't just give them black tape. And so I believe strongly in the importance of teaching healthy attitudes, healthy behaviors, and most importantly, and I feel very blessed to have gone through the Wesley Family Practice Program under Gail Stevens, Dr. Gail Stevens, who strongly believed in the power of the doctor-patient relationship. And we have an erosion of the doctor-patient relationship going on right now where people don't trust their doctors, don't spend enough time with them, and consequently they don't get that mentoring and that teaching that I think is so crucial to have patients become co-learners, to become empowered by the process of discovery that's necessary to just find out what those underlying causes are and help people actually get well. So this business of where you ask the doctor about, really is a trick, which means you're going to confront the doctor. I'm going to point out just a little bit later how destructive that can be, because it's not working as a co-learner. It's billed that way, as if you're taking charge of your own health by coming in and telling the doctor, I need this drug. But in reality, it's creating a us-them kind of polarization in the doctor's office. You can follow along with me. The fourth panel here, the profession of medicine is being compromised by the business of medicine. And I think Jane was talking about how, or someone was talking about how they remember when it used to be that medicine wasn't really a for-profit system. It was a system to help people get the care they needed. And what's happened is that medicine has become big business. And just to kind of demonstrate that, of course, the drug ads on TV are the most prominent thing, but what you as consumers don't see is how the medical journals have changed. It used to be that the medical journal was a kind of an academic work where there wasn't any ads in it. But now you'd be appalled if you actually saw them, that for every one page of information, there's at least 2 pages, and sometimes 3 or 4 pages of drug ads that really appeal more to the doctor's emotional sense. It's something to kind of give. There's a few little charts in there to suggest that that there's some research being done, but most of it is someone that looks like the doctor, someone that looks like his wife, smiling now that she's taken such and such a drug. So, one example of this, where we think that these medicines are really working, and they're promoted as if they work. The pravastatin, which is a statin drug for cholesterol, was reported to have a 19% reduction in the risk of stroke, and that's what would be in the ad. This big bar showing 19% reduction. But in reality, that only benefited those people who had already had an MI. So the doctor may not have noticed that. And when you adjusted it, for high blood pressure and diabetes, the statistical significance of that 19% was lost. And not only that, but of the subjects in the study, 83% were men whose average age was 62. But most strokes occur in women whose average age is 69. And when you actually looked at the women in the stroke who were older, over 70, they had 21% more strokes when they took that particular medicine. And so anyway, that would be an example of how the drug ad is very misrepresentation of the actual statistics in the study. So there's a kind of commercial intrusion into science that's going on right now, and it's surprising how many research specialists are really just consultants for the drug companies. The medical schools have become more and more dependent upon grants they receive from drug companies. The traditional function of the university to be a bastion of scientific objectivism is kind of being lost as they become addicted to the funds that they get from the drug companies. So, unfortunately, we as consumers, or many people as consumers, 4 minutes left?
Oh, no.
No, I'm sorry. 14 minutes left.
14 minutes. You're good. I say, wow, that went fast. The consumers, really, the idea is on TV is that if you take this drug, you're going to be healthier. And if it's the latest and most expensive drug, then it's really going to be good. And it's amazing how much the direct consumer advertising has increased in recent years. $55 million spent in 1991.